This is Miss Gray doing the exercise or lecture on Chapter 14, Implementing and Evaluating. Implementing is the fourth phase of the nursing process. It involves these 5 steps that are testable: reassessing the patient, determining the nurse's need for assistance, being that when you are assessing a patient, if your patient's condition is changing or they're becoming more critical, sometimes you have to call for help. I mean, you're working on a unit with a team of people in many instances, or even if you're working in home care, you might need to transfer the patient to another facility because they need more than you can manage alone. Implementing the nursing interventions that you're going to create that are patient-specific. Interventions are always patient-specific. They're always timed. Interventions are always timed and dated, and they're always patient-specific. And you're going to be supervising the delegated care, meaning that every intervention that you create, you or write, or that you order as a nursing order, you're not going to have to do. You're going to be working with unlicensed assistive personnel or nursing assistants. And so you as the nurse then correlating the concept of legal to this section, you have to know what you can delegate to the aide and what you cannot. You have to remember that you are always responsible and held accountable for anything you have the aide do, but you will at times have to have them help you out because you cannot do, or we do work as a team. Also, you have to document your activities, because if you do not document your activities, it was not done. Now, the nursing process, again, has several phases. The implementation process is based on assessing, diagnosing, and planning. It provides a basis for what you're going to do. So your assessment, your diagnosis, and your plan drive the nursing care that you're going to provide. Should you be checking a blood sugar? Should you be rechecking a blood pressure? These things, these tasks, these skills are founded on your assessment. And your implementation provides actual nursing activities. So when you are assessing, you're gathering data. When you create a nursing diagnosis, you identify problems. And not only problems. When you're assessing, you're looking for the patient's strengths as well as any problems. So assessment is a dual identification of strengths and weaknesses that the patient may have. And it drives your nursing activities and the responses you expect to have in the implementation phase. So to be a successful thinker and implementer as a nurse, you're going to use cognitive skills, interpersonal skills, and technical skills. You're going to be thinking about what you should do. And then you're going to use your communication skills and your therapeutic communication and work collaboratively with other members of the team. And you're also going to have technical skills such as taking vital signs, changing wounds and dressings, and giving medications. And we've talked a lot about cognitive skills, and you're developing those really well. Interpersonal skills, these are valuable to know, and it's just actually a review of what we had in the communication section. And then you have the technical skills, purposeful hands-on skills, and you're learning many of those, just like your vital signs, performance tests, and other skills and things you're learning in this skills course. And there are 5 activities in the implementation phase. You're reassessing the patient, you're determining your need for assistance, you're implementing your interventions, you're supervising the delegated care, and you're documenting your activities. And again, all of your interventions must be timed. That's a very key component for your practice and for your care. And remember that you're reassessing your patient, because the nursing process is an ongoing and dynamic process, and often you'll have to change your interventions based on the status change of your patient. or your patient could be improving. So the status change does not have to be for the worse. Sometimes your patient is getting better. That's what we want. So we can reduce the number of interventions or reduce the level of interventions because your patient is improving. And sometimes, again, you have to remember, do you need assistance? Do you need to get the help of a more experienced nurse? Can you provide the care that you need safely? So again, good judgment as a nurse does not mean that you do everything alone. It means that you also understand when you should get help. And your nursing interventions are based on scientific knowledge. Again, this is why we're teaching you to look up a rationale in your nursing diagnosis book to relate to your intervention, because we're scientists and we're applying the science to our care. You want to have your interventions be clear, adapt them to the patient. So I wouldn't expect the 85-year-old to walk 3 miles. I might expect them to walk a couple hundred feet, but my 20-year-old might walk 3 miles over the course of a week. So you want to correlate your interventions to the needs of the patient, and you want to really important in interventions is always to have the patient do as much for themselves as they can. Now, it's a very important concept for testing, for understanding the nurse-patient relationship, is that we're not trying to foster dependence. We're trying to build and foster independence. We want the patient to be as independent as possible. Providing care does not mean we immobilize them. It means that we build their independence, and we want to provide teaching and support. Remember that the process is holistic, and we're partners with our patient. They are partners in their care, and we want to provide care in a dignified manner. Always be careful with your delegation, knowing who and what you can evaluate. Remember that you as the nurse are responsible for the patient's overall care. Make sure that you document all of your activities, because as you remember, if it's not documented, it was not done. And then after you have performed your interventions and you've evaluated the patient, you're going to collect data to evaluate, were my interventions successful? And you're going to compare the data that you have after your interventions with before your interventions to determine, was there a change to the better, or was there a change for the worse, and what am I going to do about it? You always relate your nursing activities to outcomes. We don't do anything in nursing without a purpose, and you're always continually adapting and modifying your plan.